I'm Dr. Markmann, board certified plastic surgeon.
Hi, I'm Brittany Wilson, nurse practitioner.
And I'm Scarlett Davis, medical esthetician.
We just want to welcome everybody back to our office again. We are open, social distancing, and following all the COVID safety precautions.
We would love to see you guys, so please come in when you guys are ready.
We have prepared our office to receive you. We have sanitized, we have taken all the precautions necessary in order for you to have a safe and proper visit with us.
Nothing is more stubborn than unwanted fat. Seems like no matter what you do, it just won't budge. April is no stranger to this struggle.
I'd spent many years in the gym exercising. I've had children, so trying to lose the baby pouch, and it was just next to impossible.
She just could not get control over her weight gain. So she started researching her options to take back control and finally get results. And that's when she saw Dr. Markmann on the Metamorphosis show.
Met with Dr. Markmann and we went over everything and decided to do the tummy tuck. Surgery went great. I spent the night at the hospital. They took great care of me. Dr. Markmann was excellent with all the aftercare instruction. It went very smoothly, no major bumps in the road, and here I am 3 months later and I feel fantastic.
Next, we're going to go in and see April. April's here for her 3-month follow-up from a tummy tuck, liposuction all the way around in the upper back area. So 3 months is typically when you reach your final size and shape because most of your swelling is gone by that point. So we're going to go check her out. So let's see how yours is doing. All right. So you look beautiful. Got a nice skinny waistline that looks great. Nice rectus muscles down the middle here. Probably still a little bit swollen, but not much.
Yeah.
And your scar looks great. Your scar is doing beautifully. So nice and thin and flat. It's a little bit red, but when you squeeze the color out of it, that's what your scar is going to look like when it's all done.
Okay.
So that's doing beautifully. Just that thin little white line there.
Okay.
Okay. So that's good. And any pain down here? Any lumps down here?
No, that's where, but I notice this is where I get the most
swelling.
swollen, yeah. And then I notice like up here too, it's weird, like I'll get swollen up here, and I feel like I feel so full, but then it goes away, but it's just a weird feeling.
Right. So when we do a tummy tuck, what we do is we tighten up your muscles inside. So a lot of people find they get full very quickly.
Yes.
So people tend to eat less. They tend to lose more weight after a tummy tuck because of the tightening of the muscle part.
Okay.
Okay. So usually that goes on for 6 months to a year as well, where people tend to say they just get full very quickly, and then again the benefit is they tend to keep on losing weight, which is good. So scar line again looks great. Any spots on here of any concern to you?
No.
No. Looks good. Are you treating your scar?
Yes, I've been using the silicone, yeah.
Definitely keep doing that. And we did your back. Let me see
Yes.
from the back. Want to take the robe off? So back in here, definitely, your scar back here is doing beautifully as well. So I just do one scar up top here to liposuction the whole upper back area. Give a beautiful curve to your low back and beautiful curve to your waistline. That looks great. Little liposuction scar here and here. Again, they're going to fade away to nothing pretty much. So once they're faded, that's what that's going to look like as well. So very, very minimal. Again, it gives you a beautiful hourglass shape that way. Just taking all the fat out of here. That looks beautiful.
He's wonderful. He's so kind and caring, totally comfortable. Never felt like there were any questions that went unanswered. Just overall, he's just a fantastic doctor. The results are better than I could have expected. I mean, they are just fantastic. I've gotten so many compliments. People are just amazed at the transformation. Dr. Markmann is absolutely my favorite doctor in the whole world. I've already recommended him to so many people.
My name is Brittany. I'm the nurse practitioner over at Metamorphosis. So today we do Dysport Tuesday. So second Tuesday of every month we discount the Dysport, which I absolutely love. Very similar to Botox. Actually, I like it a little bit more than Botox. So today we have a patient that's just gonna get a little bit of a refreshed look on the upper face. So come on in and you can watch.
Hi, my name is Jennifer. I watched the show and I love it. I came in today to have a bit of a relax on my forehead. As I've gotten older, I've noticed what used to be a smile has turned a bit into a scowl, so in order to seem a little bit more inviting, I'm going to have the goalposts between my eyes relaxed slightly.
So with our beautiful patient today, as she said, we're just going to relax this part, which is called your glabellar complex, which makes you kind of look mad, or we call them the 11s. I love that she called them the goalposts. Whatever you like to call them, we're gonna relax them. And then the other thing, we're gonna put a little bit in her crow's feet, and that will help lift the lateral brow. It's technically called a chemical brow lift. So the surgical brow lift would be when you actually cut and lift the skin. This is just using the neurotoxins, Dysport, to just relax this muscle that's around the eye to just help open her eyes. My goal is just to make her look a little bit refreshed and happier, and that's it.
I've been once before. This is my second treatment with Brittany today. Brittany's great.
We want that really refreshed, awake look. So this will start to activate within about a week. So you'll be able to see the result. And then in 2 weeks is when I'll check in on you to make sure that you're happy with the results. You're good to go, and we'll see you in 3 months.
Excellent.
All right, it's so good to see you.
Envision. A profound transformation. Turning dreams into reality. Take a leap into the journey of metamorphosis. With the help of Dr. Markmann and his experienced team of professionals. Like many guys that work out and diet, Brandon had some fat that just wouldn't go away. No matter how hard he pushed himself, the tone and definition he was trying to achieve just wouldn't happen. So he decided to find someone out there that might be able to help surgically give him what nature and hard work couldn't. Like anyone looking to do surgery, Brandon decided to do some research of his own. Finally, he found the best person for the job and a solution to his problem. He discovered Dr. Markmann and Metamorphosis Plastic Surgery, and was so impressed with his credentials and results that he knew he'd found the right doc for the job.
I did my research on Dr. Markmann. All his results from previous patients were phenomenal, and he's got a lot of good reviews. I just felt confident with going with him, and I didn't have to meet any other doctors. He was my only one, and I felt good with him, and it was an easy decision for me.
So next we have Brandon. Brandon's a gentleman that I did a 6-pack on 2 months ago now, I guess it is. He was already in the show several weeks ago, or very early after surgery when things were still kind of developing. It takes at least 3 months to see the full effect of the 6-pack. He's about 2 months right now, so we're gonna check him out and see how he's doing. Definitely took out all the fat I can get out of these lines here. So definitely it's still a little swollen in those areas. The areas here, there's almost no swelling at all. So as time goes by, I expect this is gonna get a little deeper here, a little deeper here. But you look awesome. Scars have pretty much faded away already. There's no fluid collections or anything anywhere I can see or feel there, so you look amazing.
Yep, love it.
You're happy with it?
Very, very happy.
And if you crunch, it tightens up even more like that, so yeah.
I do not have any discomfort at all, no pain, very minimum swelling, no fat, no fluid in any of the areas that Dr. Markmann did, so it feels really good, looks really good. The results are 1,000 times better, more defined. It's getting better and better as we go along. Everyone can definitely tell a difference from the revealing and being on the show previously to now. So everyone does see that it is getting better, and he does a really, really, really good job. And he takes good care of your body. So I definitely recommend Dr. Markmann to anybody.
Walking a mile in our patient's shoes is something that all of my clients do. So Kate, interesting story, had implants, had them removed, wants them back in. So had I think one baby in between there from taking them out to now. So things are a little deflated, so she wants to fill them up again, just not as big as they originally were. Again, one of the problems in the old days was choosing the right size implant for patients. It was very tough for them to choose because putting them in the bra never looks accurate. So our machine Vectra is 99.6% accurate. Whatever you see on the computer is pretty much what you're going to get. So I show patients all different sizes. They get to choose the size that they want, and then we put them in, and I've never had anybody come back unhappy with that.
In 2010, I had breast implants put in. I was only 18, so I got a size way bigger than I wanted down the road. I ended up taking them out in 2018 from just feeling like they're too big for my body, and they actually started hurting me as well. So I had them removed. Fast forward to now, I'm just not happy with the appearance anymore, so I came to Dr. Markmann. I heard he was really good, and I have faith that he's going to give me a really good look, but more natural.
Having had implants in and out, some people do get a little pocket of scar tissue in there. I don't feel any in there, so that's good. So again, not being sure whether your implants are on top of the muscle or underneath the muscle. I can't tell at this point either, but you got beautiful breasts, nice shape. That's what gives you your shape afterwards. So being that you had prior implants, I'm sure you, well, hopefully you liked your shape at that time.
Right.
We're gonna put implants back in just a little smaller, and hopefully they'll fill out very nicely. And then again, you mentioned ripples and folds. That's typical of saline. You typically don't get that with silicone. So we'll do the Vectra imaging when you come in for your pre-op appointment, and in that case, you get to choose what size implants you want.
Okay.
So the Vectra imaging is going to take pictures from all different angles. The computer puts it back together into a 3D image, and then we'll show you different sizes from 100 cc's up to 700 cc's. You pick what you like.
Okay, awesome.
Okay?
Yep.
Typically, I do the scar in the crease. That is the safest way to do it. So capsular contractures, which just sounds like you had a capsular contracture before,
Right.
where the implant gets hard. It's really nothing wrong with the implant. There's nothing wrong with your breast. It's just the scar tissue, which everybody has around the implant. Everybody's got a capsule. It's usually paper thin. In some people, it gets real thick and it starts to squeeze and tighten around the implant. So that's a capsular contracture because the capsule is contracting. So that happens, or it's been shown to happen or be caused by bacteria. So when you're going through the nipple, you're cutting through the ducts going into your nipple, and there's bacteria in them. So even though we scrub your skin on the surface in the operating room, there's bacteria down inside. Same thing with the armpits. There's lots of bacteria in your sweat glands. So even though we scrub the surface, as soon as we cut into your skin, it exposes the implant to bacteria. So I prefer to do it through the cleanest area, which is the crease, which usually heals beautifully. And it's much cleaner, so less bacteria in that area, so less chance of getting a capsular contracture.
Sounds good.
Okay?
Yep.
Any questions?
He made me feel really good. He has a really good bedside manner. He made me feel relaxed. He's very knowledgeable, gave me a lot of information about the different implants and which way would be the best way to go about it. So I feel very calm. And previously when I had my breast done, I literally just put the implants in my bra and you can't really get a good look at that. So when he told me about the vector machine, I think it's cool that you can actually see what they will look like on your body. I have seen the Metamorphosis show and I really love watching the different transformations, and I know that I'm in good hands and that Dr. Markmann will give me the look that I'm hoping for.
Genes are amazing. They shape every feature and aspect of us as people. Passed down from one generation to another, they are our legacy. Some genes are great, resulting in beautiful eyes, hair, and skin. Others, not so much. Like Pravesh, who unfortunately did not win the genetic lottery.
I have multiple lipomas on my arm. This is genetic for me, so some of my family members, like my grandmother has it, my aunt has it, so this is something I was born with, but it usually comes as I get older. I love watching the Metamorphosis show, and that's why I came in today.
So first we're just going to mark which ones we're doing. So that's one of them. So that's just the lipoma there, and we're going to do one scar right across here. Okay, and the other one?
The other one is this big.
That's the other annoying one?
Yep.
Okay, so same thing. We're going to dissect around the whole thing. And here, just a short scar that way. Alright, so we're going to do a little numbing right where the scar is going to be. So we do a little what's called hydrodissection, just meaning the pressure of injecting all this fluid helps to dissect around the lipoma. Anything sharp here?
No.
Good. Feel some pressure here. It should not be painful. If anything hurts, let me know. We got plenty of numbing medicine. But the numbing does not get rid of that pressure sensation. So some of that liquid coming back out is just the numbing. I did put quite a bit in there. Everything all right?
Oh, good, yeah.
Good. So basically I just spread all around it, freeing it up. Try to get underneath of it as well. And then hopefully it'll just pop one out of there when it's ready.
Are there any big nerves around it, or?
Lots of them.
Oh.
Arms have got lots of nerves and blood vessels and tendons and muscles, and fortunately they're all deeper than we are, so should not be an issue. And there it is. I think it's a girl. If you get into it, it just becomes more normal fat. But on the outside, it's got this nice tight casing around it, so it makes it easy just to pop them out. All the stitches will be underneath your skin, that way you don't get stitch marks.
Okay.
And also that way there's no stitches to take out. Alright, so same thing, you feel some pressure. If anything hurts, let me know.
Okay.
Again, we're just dissecting around it, freeing it up from the surrounding skin and the tissues underneath of it. That's why I draw the circle around there so I know how far we need to go. And we just free it all up. Good squeeze. There it is. I think that's a boy. I hope you're okay with the boy this time.
A boy and a girl.
One of each. You got them both.
Yeah.
Twins.
It went really great. I was pretty comfortable the whole time, and no pain at all. And I think the doctor did a great job. I would recommend Dr. Markmann to anyone.
All right, so we just finished taking out a couple lipomas from Vitesh. Lipomas are kind of fun taking out. They just make a little tiny incision. You can squeeze them right through there. They pop out like a little baby of sorts. So he's got tons of them. We can never take them all out. So what I always tell patients is pick the ones that bother you the most. Let's remove those. If the other ones get bigger and you want to take them out, we can always take them out. But to take them all out, he'd have scars all up and down his arms, and he's going to make more. So we go after the ones that are bothersome, and he has just 2 tiny little scars, as you saw. So that's a pretty minimal procedure, hardly blood at all. So he should have a little bit of discomfort when the medicine wears off, but then back to work and back to normal. So we'll see him back next week to check everything out.
I love watching the Metamorphosis show, and that's why I came in today.
So next we're going to go see Laisha. Laisha's here for a consultation for a BBL. She has supposedly been to one other surgeon and was told she was not a candidate. So we're going to go talk to her, take a look at her, and see if she is a candidate to do a BBL.
Typically, all my life, my entire family was well-shapely as far as like the women are concerned, except for me. I just so happen to be the one to get the body like my father. So while my sisters have beautiful curves and nice butts, I kind of missed out on that.
So you do have a little bit of skin laxity, okay? Good bit of fat down here, which is great for BBL, so we can sort of take all that fat out of down there. We can thin this out a little bit, but part of the issue is having had babies, your muscles have separated.
Mm-hmm.
So 2 babies, some people get away with 1, but usually by the second time, muscles are kind of separated. So when we're young, our muscles go from our ribs all the way to our pubic bone, together at the midline, right down the middle. It's your 6-pack muscles. When women get pregnant, they tend to come out and separate. You deliver your baby, they come back in, but they never come back together. So when they're together, they're kind of like glued together, and when you pull them apart, you get this very thin membrane between them. Some people get hernias down the middle here, but there's no exercise that brings them back together.
Okay.
So when we do a tummy tuck, we sew them back together. So right now your muscles are like this with a gap between them about that wide. We're going to take them and sew them together like that, which flattens your belly.
Okay.
It also slims your waistline a little bit. So you can do that at the same time as a BBL, or you can do that later on. That's up to you.
Okay.
Okay. For the tummy tuck, we remove all the skin from here to here. So it's kind of a great big wedge of skin. Everything between my hands gets cut out and thrown away. So it leaves you a scar from here to here. So it's a big scar. Liposuction, on the other hand, there's 2 little scars here, 1 scar in your belly button. All scars are about that big for liposuction. Little tiny scars. So we can liposuction this and thin this out a little bit, but it's still going to be round. Okay. Take all this fat out and definitely give you flattening down here for sure. Your waistline, everything from here in is muscle. So from here out is all fat. So when we do liposuction here, this will all go away. Your waistline's going to look just like that, if you can see that in the mirror.
That looks great.
I'll turn this way so you can see in this mirror here. So everything from here outwards is removed. That's all the fat. Okay. Maybe take the robe off. Let me see from the back. So back in here, everything from this crease on down, we call your flanks. So maybe turn this way a little bit better. Okay. So flanks is here. Everything above this crease is called your dorsal roll. In women, it's usually 3 rolls. Women call it brow fat, back fat, brow rolls, whatever. So to get rid of the fat up here, I do 1 tiny little scar under your bra strap. Again, we're talking about 1 centimeter long, not a big deal. And then for the low back area, what we do is 1 scar in your butt crease. Gives me access to liposuction most of this. Usually I need 1 on the butt cheek someplace, or sometimes I'll hide it along your tattoo to get around your waistline.
Okay.
And you were saying you're looking for more of that roundness for your buttocks, or give you a little bit of a wedgie here. So you wanted to get rid of this.
Yes, definitely.
Okay. So part of that, I would definitely fill in with fat, but also looking at your hip area here, or your thighs is what I call it. So basically draw a line from your buttocks crease around here. From here up is your buttocks or hip. From here down is your thigh.
Okay.
So I would take this fat out, because making you skinnier here is instantly going to make you look more round.
Sure.
So right now this is the widest part of your body. I want to see this be the widest part of your body. That's what gives you that nice round buttocks. Doesn't have to be huge, but just shapely is the goal, I think. So.
He made me feel very confident that what I was looking for was possible. He was very knowledgeable, very experienced, and I felt like I could trust him in my body with him, because he's been doing this for years, and he answered all of my questions. He even posed things that I didn't even think about initially. He presented that information to me as well, and I wouldn't even have thought to ask some of those processes, and he was just very helpful, very informative, and he made me feel really confident and sure that this was the best place to be.
All right, so we just saw Laisha. She's an excellent candidate for doing a BBL. She's got plenty of fat to work with. She does need a tummy tuck if she wants a flat belly, but what I'd recommend is she do the BBL first, see if she's happy. If she's not, she can always come back later and do the tummy tuck.
Staff is amazing. Everyone's so helpful and pleasant, and I met, actually when I first came in, I came through and did a whole walkthrough tour of the entire office, met almost all of the staff, with the exception of the ones that were actually in the offices doing some type of procedure, and everybody was just so pleasant. It was just a very, almost like a family-oriented atmosphere. I really like it.